What we really need today is a new way to detect aggressive prostate cancer. While we've relied on the PSA test in the past, the 4K score test is really an optimized test. It eliminates some of the noise in the old PSA test and really focuses on whether there actually is aggressive prostate cancer.
PSA can be elevated for any number of reasons that are not directly related to prostate cancer.
The 4K score helps one make a decision beyond the only evidence, which is the PSA.
My decision to get a biopsy was definitely proven by taking the 4K score test.
Now, we may still need to do prostate biopsies to detect whether there's an actual cancer, but we'll now know which men don't need to have a biopsy or are less likely to have aggressive prostate cancer.
The test basically is an assay of a panel of PSA-related markers, and measuring this panel of 4 markers together gives us better information about what PSA means than PSA by itself.
I think it gives us more information instead of instinctively resorting to a biopsy.
Across the board, we found that we were able to reduce the number of biopsies from 10 to 50%, and yet we still found almost all the high-grade Gleason 7 or higher cancers that were present in these men.
The utility of the 4K score test is that it helps me as a urologist to determine if a patient's at risk for having an underlying aggressive prostate cancer.
It allows the doctor to have a more educated view of the best course of action, and it tells the patient what's their risk now and long term of developing a potentially lethal prostate cancer.
At the end of the day, as a man, I want to know if I have a cancer, will it kill me or not? And that's the bottom line, and we need to make that distinction.
If the 4K score test wasn't available, I would be doing unnecessary biopsies on patients who simply have elevated PSAs but no underlying clinically significant prostate cancer.
One of my patients, Neil, had a previous negative prostate biopsy over 1 year ago. He returned to my office recently and his PSA was still elevated. Needless to say, he was very anxious about it. The 4K score test was drawn and it came back at 5%. That meant that he had a very low chance of having clinically significant prostate cancer, and we decided that a repeat prostate biopsy was not appropriate and we can consider following this conservatively, and he was happy about that.
And the particular fact that a large number of patients had been clinically correlated with this test made me feel very comfortable.
The 4K score test will relieve a tremendous amount of anxiety that this country has, that men have.
The 4K score test lets me really zero in on patients that need to go to the next step to have a prostate biopsy done.
We need a more specific test to really determine whether somebody has a significant cancer, and that's really what the OPCO 4K score test is really all about.